I just performed hand hygiene and I'm gonna close this door for privacy. Okay?
Okay.
I gathered all my supplies and they've all been wiped down and cleaned. So, hello, my name is Bree. I'm going to be your student nurse today.
Hi, Bree.
I'm gonna take a quick set of vitals if that's okay with you.
Of course.
Perfect. And then can you confirm your name with me?
Malcolm Reynolds.
Perfect. And what do you like to go by?
Mal or Captain.
Okay, Captain. Can you confirm your date of birth?
June 8th, 1986.
Okay, perfect. Thank you. All right, so I'm going to start off by taking your pulse.
Okay.
If I could borrow an arm.
Of course.
Thank you. So for the pulse, I would put my fingers in between the bone and the tendon on the side of the thumb on the radial artery. And I would I would count for 30 seconds if regular, and then just multiply by 2. If it's irregular, then I'll count for a full 60 seconds. Perfect, and it's 2 plus regular. So now if you could just put your arm across your chest.
Of course.
Okay, and at this point I wouldn't tell the patient, but I would be assessing for respirations. Respirations would be, one respiration is one rise and fall of the chest. If I was having a hard time taking his respirations this way, I would auscultate the trachea to listen for breath sounds. At this point, I would look at respirations for 30 seconds if regular and multiply by 2. If it's irregular, then I'll go ahead and just do it for 1 full minute. Perfect. And his respirations were regular. It didn't look like he had a hard time breathing or anything like that. Perfect. And then alternative spots to take his pulse would be the brachial artery, so just inside his arm, or by popliteal pulse, which would just be right behind the knee right here. Perfect. And then I could also take his pulse by oscillatory method. So I could take his apical pulse for 1 full minute, which would be on the left side, on the 5th intercostal space, mid-clavicular line, or at the apex of the heart. So now I'm going to take his blood pressure, if that's okay with you?
Of course.
Perfect. Okay, so for the blood pressure, I want to talk about correct cuff placement first. So the cuff needs to be about 1 inch above the brachial artery. It needs to cover 2/3 of the arm from the shoulder to the elbow. It can't be too tight, so I have to make sure 1 finger fits inside. Perfect, so I'm just going to place the cuff now. And have you had anything to smoke or drink in the last 30 minutes?
No.
No caffeine?
Nope.
Okay. And then you want to make sure the cuff is not, or the clothes is not under the cuff. Perfect. Okay, it's not too tight?
Nope. Feels fine.
Perfect. And then with my stethoscope, when I place it, I want to make sure my diaphragm is not covering, is not being covered by the cuff. I want to make sure nothing's rubbing up against it so that I get an accurate reading. I'm going to palpate his brachial artery, and then I'm going to inflate the cuff until I can no longer feel the pulse, and this is going to give me an estimated systolic number. And then I'm going to continue to inflate the cuff about 30 millimeters of mercury above that number to make sure I don't miss the auscultatory gap that some patients have. And then I'll take his blood pressure. Perfect. Okay. Okay, was 120. So I'm gonna fill it up to 150 and then let it drop by 2 millimeters of mercury at a time. And then I'm gonna listen for the first and the last sound. Perfect, so that was 126 over 80. Other methods to take the blood pressure would be on his forearm and his thigh. Thank you so much.
Thank you.